Good day, listeners and viewers. On today's COVID-19 update, Minister of Health Dr. Frank Anthony says the ministry is monitoring COVID-19 cases across the country, and he also encourages persons to come out and take their COVID-19 vaccines. Can we begin with an update on the Festival City Health Center?
Well, at Festival City, we've been working to complete that project. We estimate by the end of this month the project would be completed. There might be still some additional works like around the yard and so that we'll have to do, but those would have to come in next year's budget. It wasn't budgeted for in the current budget. But nevertheless, we anticipate once the construction is over that we will be able to move in personnel, acquire the necessary equipment, and put the facility to use.
Can you tell us if the physical work has started for the establishment of a comprehensive diabetic care facility on the identified venue?
Well, that diabetic center that we're talking about, a kind of one-stop shop for diabetic patients, we had awarded the contract. As you know, we had publicly advertised. There's someone who won the contract, and that has been awarded. They have now been given a mobilization fee, and so they're now in the process of starting the foundation for this facility. This facility would be built at Lusignan, and when it's completed, it would offer diabetic patients a comprehensive range of services. So if you're a diabetic and you go there, you will have the doctors to see you, the endocrinologists. You will also have someone who would be able to counsel you in terms of nutrition, telling you what to eat, how to prepare your meals. We'll also have laboratory support there, so all the blood tests and other tests that you would need to do can be done there. We'll also have an area there where they can examine your eye, because that's another important part of the management of diabetic patients, and also how to do foot care. And if you need prosthesis for your foot or special types of shoes, they would be able to take the measurements and to be able to offer those special shoes for diabetic patients. So all the services that a diabetic would need to have would be offered at this center. So it's the first of its kind in Guyana. And if it works well, as we anticipate it should, then we'll replicate this in other parts of the country.
Let's discuss any new hotspots being monitored for COVID-19. I know we are aggressively pursuing our vaccination campaign, but are there any sites that we're actively monitoring for cases?
So in terms of cases, as of today, we've had about 40 new cases. That might sound a little bit low, but the amount of tests that we did over the last 24 hours is about 391 tests. On average, we do much more, so we're closer to 1,500 or so tests per day. So perhaps this low number of 14 is not a true reflection of the cases that we have over the last 24 hours. Active cases as of today has gone up slightly. So we were, last week we were around 900 or so. Now it's 1,001 case rather. So that has gone up slightly. In terms of hospitalized patients, we have 66 persons who are hospitalized, with 16 of them in the ICU. And most of these patients are at the Ocean View facility. And over the last 24 hours, we've had 4 deaths being recorded. When we look across the spectrum, because we've had we have seen a decreasing trend in cases. So the numbers generally has gone down a little bit, and across the regions we're seeing that. Region 1, the area with the most cases is really Mabaruma, and currently we are monitoring 10 cases in Mabaruma. In Region 2, Wakapau has 15 cases. In Region 3, Crane is the area with the most cases in Region 3. There are 17 cases there. Region 4 on the East Bank, we have Grove with 25 cases, Diamond with 15 cases, Eccles with 15 cases. These are areas that we have been seeing a lot of cases consistently for a protracted period of time. On the East Coast, we're seeing cases in Mahaika. So we have 18 cases now in Mahaika, and we have 16 cases in Enmore. These are the highest for the East Coast. And in Georgetown, we're seeing cases in Kitty and Lodge. So we have 21 cases in Kitty and 19 cases in Lodge. Region 5, generally, we haven't seen a lot of cases, but we still have active cases in Region 5. Region 6, we're looking at New Amsterdam, where we have 24 cases. Region 7, Partica with 21 cases. Region 8, we do have cases, but for whatever reason, we are not seeing a lot of people coming out to be tested. So those numbers are relatively low, but it's not a true reflection of maybe cases that we have in the region. Region 9, on the other hand, we have 13 cases in Lethem. This is the highest area these are the highest amount of cases in one area in Region 9. And Region 10, again, not many people coming forward to be tested. So with a relatively low test rate, we're not seeing much cases showing up. But not that they don't have cases, it's just that people are not coming forward to be tested.
Is there like a specific age range we're seeing persons being infected?
There's no specific age range. We are seeing people across the age spectrum getting infected, and we continue to monitor that. Male and female ratio is pretty much the same. And as I said, by distribution by regions, in all the regions we do have cases. So as of yesterday, we have had 287,837 persons who have received their first dose vaccine. That's about 59.1% of our adult population. And for second dose, we have 147,128 persons. That amounts to about 30.2% of our adult population. So we have seen a general uptake in the first dose vaccination, which is very good. When you get a vaccine, generally you would have, for some people, you'll get a little bit of side effects. Those side effects would be a little bit of pain on your arm. Some people would experience fever, a little bit of fatigue. After a 24-hour period, maybe 36 hours or so, all of those side effects would disappear. So side effects don't last for a very long time. They're temporary kind of thing, and that depends on how your body reacts. So there's nothing where you would see side effects 1 year after you got a vaccine. Every person in Guyana, I would say, would have received vaccines during their childhood. And I don't know of any child who receive a vaccine today still have side effects 1 year after. So a lot of these things that are being said, I think all people need to do is think back to their own experience with vaccines and to see whether or not this is making sense. And I'm sure if they reflect upon it like that, they will know that what is being peddled is really nonsense.
This has been DPI's COVID-19 update. For more information, visit our website dpi.gov.gy or health.gov.gy and our social media platforms.